Have you ever wondered how doctors get a peek into the electrical symphony happening inside your brain, especially when trying to understand conditions like epilepsy? Electroencephalogram, or EEG, results indicate epilepsy when they show specific patterns of abnormal electrical activity in the brain that are characteristic of seizures. These patterns are often called epileptiform discharges. While a single abnormal EEG does not always mean epilepsy, consistent or characteristic findings, especially when combined with a patient's clinical history and symptoms, are key to a diagnosis. The reason EEGs are so valuable is that epilepsy is fundamentally a neurological disorder characterized by abnormal, excessive, or hypersynchronous neuronal activity in the brain. The EEG machine records these electrical signals through electrodes placed on the scalp. When a person experiences a seizure, or even between seizures, specific telltale brainwave patterns such as spikes, sharp waves, or spike and wave complexes can appear. These patterns reflected the sudden, chaotic electrical discharges that define epileptic activity. To accurately interpret these results, a neurologist, which is a doctor specializing in the nervous system, carefully reviews the EEG recording. They look for these distinct epileptiform discharges, considering their frequency, location, and how they evolve over time. They also factor in the patient's state during the recording, such as whether they were awake, asleep, or undergoing specific activation procedures like hyperventilation or photic stimulation, which can sometimes provoke these patterns. Understanding these nuances helps differentiate between true epileptic activity and other normal, but sometimes similar-looking, brainwave variations. It is important to remember that a normal EEG result does not always rule out epilepsy, as abnormal activity might not occur during the recording period. Conversely, some healthy individuals may occasionally show minor EEG abnormalities without ever developing epilepsy. This is why a comprehensive evaluation, including your medical history and other diagnostic tools like MRI scans, is essential. An EEG is a powerful diagnostic tool, but it is one piece of a larger puzzle that helps your healthcare team make an informed decision. Ultimately, EEG results serve as a critical component in understanding the electrical landscape of your brain, guiding doctors to recognize the unique signatures of epilepsy, and helping them to provide the most effective care tailored to your individual needs. This careful interpretation ensures you receive an accurate diagnosis and a clear path forward for managing your health.